Hi, I'm Kathy. I'm going to be doing your immunization today.
Hi.
Hi. Somebody filled that in for you, that information?
Yes, yeah.
Okay, perfect. I'm just wondering if I can just confirm a couple things here. Your name, Tilda.
Mm-hmm.
Okay, Vadri.
Tilda Vadri.
Vadri, yep. And that's today's date. We also have your care card number.
Yep.
Okay, birth date, and then your correct address. And is this the right number to reach you at?
Yeah.
Okay. Before we get going, there's just a couple questions I'm going to go through together with you. And then based on your answer, we'll make sure that today's the right day for you to get the vaccine.
Okay.
So what we're going to start with is, are you feeling well today?
I'm feeling good.
Feeling good?
Yeah.
Great. Allergies. Do you have severe allergies?
I am allergic to peanuts and strawberries. I puff up.
Okay, all right. So food allergies, are not a contraindication to getting the COVID vaccine. It's good to know about those, so that's great. What I do also have to ask you about is polyethylene glycol, whether you have an allergy to polyethylene glycol or PEG.
I don't know what that is.
Yeah, no, and you're not alone. So we call it PEG prep. It's a common ingredient in things like cosmetics and laxatives. And because it's one of the ingredients in the vaccine, we are calling it specifically and asking people specifically about it.
Yeah, I don't know.
No, so I think you're fine if you have not had any reactions to that. Today is your first dose, correct, for the vaccine? Great. And have you ever had a lab-confirmed COVID disease? Have you had a COVID test that turned out positive?
No.
No. What about getting needles, getting vaccines? Have you ever fainted or felt unwell after getting a vaccine?
No.
All right, Tilda, so I'm just going to cover a couple of things you can expect over the next few days and talk about some benefits and some side effects as well. So you are here for the COVID-19 vaccine. Today we're giving you the Pfizer, but the COVID-19 vaccines offer you some protection from the COVID-19 disease. So that's what you're here to get. Some of the things over the next few days, there's some common things that people experience when they get the COVID-19 vaccine. Most common are things like pain at the injection site. Okay. You might also have some tiredness, some joint pain, or some headaches, might be some muscle pain, and maybe some chills or fever. The other thing that is much, much, much less common, but you might get some enlarged lymph nodes, and those are usually the ones, around the neck and so on. Those side effects are going to last maybe a day or so if you do have any of them. You can take some Tylenol if you're feeling very uncomfortable. You can put some ice or some coldness at the injection site if it's very tender. And again, they should pass in a few days or so. If you're still feeling unwell after a couple of days, we do recommend that you call 811 or check in with your care provider. With any vaccine, there's always a very rare chance that you might have quite a strong reaction, sort of like what you were talking about with your peanuts and strawberries, but it could include hives or difficulty breathing or some swelling. So for that reason, we actually ask every single person to stay for 15 minutes after they get the vaccine. We have a room, there's staff in there, so you're monitored for 15 minutes. It's just around the corner there. So just for planning, you do need to stay for 15 minutes after the vaccine. Do you have some questions for me?
I'm just wondering, are you actually going to give me the virus in the vaccine?
The virus in the vaccine? Yeah, that's a very good question, but this is new technology. So this COVID vaccine does not have the COVID virus in it. It's called mRNA. It basically means it's giving your body instructions. It's teaching your body how to protect itself when it does get exposed to COVID-19. Oh. So there's no COVID virus in there.
I'm okay then.
Yeah. So you're ready to go ahead with the vaccine?
Yep.
Okay, perfect. So I'm just going to finish a little bit of this documentation here. You've said you're good with all of this. And informed consent. Okay. And we're giving the Pfizer today, so I'll make a note of that. Okay, so it looks like we're okay to go ahead and give you your COVID vaccine today. We usually give it in the non-dominant arm. So are you right-handed or left-handed?
I'm right-handed.
Right-handed, so I think I'll give it in the left hand if you're okay with that.
Yep.
Okay, great. So maybe what I'll do is just, if it's okay, get you to tilt your chair a little bit. And also if you could get your arm out of your sleeve and roll up your sleeve a little bit for me. So my hands are going to be a little bit cold, but you're going to feel that I'm going to be landmarking just to find that muscle. All right. Great. So what I'm going to ask you to do is just relax your arm down to your side there. That's going to actually even all the way down to the side. Yeah, perfect. That'll make a difference in terms of the comfort with the vaccine. So are you okay then if I go ahead and give that? Okay. Okay. Really cold here. Yeah. Okay, I'm going to get you to take a nice deep breath. Here we go. 1, 2, 3. There we go. Good. And how are you? I'm going to give you that gauze actually, and if you could hold that right away. That's awesome. I'm just going to toss that into my sharps bucket.
That was quick.
It's okay. Yeah, it's a pretty quick dart, just right in and out, and it's a very small dose, so it should be relatively quick like that. And most people don't bleed a lot, but we're just going to take a little look and see if you need a Band-Aid. Let's take a little peek. Great, thanks. We'll put one on here just in case. There you go.
Thank you.
You're welcome. And I can take that actually if you want. Thank you. Your arm doing okay?
Yep.
Okay. All right. So I'm just going to sign that I've given this to you. And that was dose number 1. I've got my lot number here. And we gave it in your left arm. Okay. Great. So I'm going to give you a copy of this. This is the yellow copy, and you're going to take that with you. When you come for your second dose, you're going to want to show this because it does indicate the name of the medication that we gave you. So you'll get the same medication the next time, the same vaccine, I should say. Okay, so that's your copy there, and please don't lose that. Some people take a picture of it and they keep it on their camera, so you're welcome to put that in your wallet, keep it in a safe place, because you will, yeah, you'll need to bring it when you come for your next dose. Okay? So go ahead and keep that safe, and again, like I said earlier, we are going to ask you to stay for 15 minutes. We do have staff and you will be monitored, but if you start to not feel well in the 15 minutes that you're there, make sure you let somebody know. And then, of course, later on, as we discussed earlier, if you're not feeling good, don't hesitate to call 811 or your healthcare provider so that we can look after you and also get those side effects reported for the COVID vaccine.
Okay.
Okay.
And where do I go?
It's actually, you can just see it down the hallway here. You can just follow the arrows and there'll be people in there who will look after you. So
Thank you.
thanks for coming in today. Okay, take care.